Hi, everyone. Thank you. Thank you so much for attending the program tonight on fatigue management. I hope that some things that I share tonight you'll be able to take into your daily life and help you there. So let me see how I can get to the next screen. If I haven't met you already, my name is Katie Henderson, and I am an OT student at KU Med. I'm in my last semester, so I'm completing a capstone project at Gilda's Club on OT's role in cancer care. I've just had a big interest in OT's role in this emerging area of practice and what OT can do to support individuals affected by cancer. So that's the focus for this semester. My contact info is there. If you have any questions or would like to contact me in any way, you can email me at intern@gildasclubkc.org. And in addition to programs that I'm implementing during my time here this semester, I'm also holding OT consultation hours. They are Tuesdays 1 to 3 p.m. and Fridays 10 to noon on Zoom. So you can always email me at that same email to schedule a session. I can help with support in managing any side effects you're having from the cancer or cancer treatment, like fatigue, just so that you're able to, better engage in what you want to do and what you need to do each day. And I can also help with goal setting. So if there's something that you're really wanting to get back to doing, something that's important to you, we can help create a goal for you, problem solve different solutions to that, weigh the advantages and disadvantages of different solutions, and then develop an action plan to just help you get back to doing that. So if any of that is interesting to you, please feel free to email me. I would love to set up a session. So yeah, as I mentioned, I'm looking at OT's role in cancer care, and OT's main role is just to support one's engagement in the activities and tasks that are most important to their daily life. So with the focus on fatigue tonight, fatigue can cause you to maybe not have the energy to do what you want to do each day. And OT's role in this is just helping facilitate engagement in those things that are important to you by, helping you cope with the fatigue through like adaptations to the environment or to what you're doing, developing different strategies and different methods to conserve energy. So I noted a statistic at the top there that from the cancer support screen, it was found that 4 out of 10 individuals felt that they were inadequately prepared to manage side effects. So that's really where OT comes in. So if you do feel that you could use some support with managing side effects, definitely send me an email and we can set up a session. And if you're experiencing fatigue, it's really important to inform your healthcare team. The information that I'm presenting on in this presentation is just from an OT perspective, so it's not an exhaustive approach to treatment of fatigue. So I really recommend informing your healthcare team if you haven't already. So what we'll discuss tonight, we'll go over a little bit just like what cancer-related fatigue is, safety considerations to keep in mind if you're experiencing fatigue. We'll go over energy conservation strategies more generally, and then move into like the kitchen and cooking, and then bathroom related strategies, and then in the community. We'll talk about sleep hygiene and stress management and relaxation. We'll touch on exercise, nutrition, and then at the end talk about management and action, what you can take from today and put into action into your life. So we'll start with what is cancer-related fatigue. One definition says that it's distressing, persistent, subjective sense of physical, emotional, and or cognitive tiredness or exhaustion related to cancer or the treatment that's not proportional to recent activity and interferes with usual functioning. So we'll discuss more, but it's multifactorial. There's a lot of components that contribute to fatigue and that fatigue impacts, and it can't just be understood strictly from one particular cancer type and treatment. It can either be acute, just lasting a few weeks, or it can be chronic, lasting months or years, and can develop gradually or start suddenly. So cancer-related fatigue versus just general fatigue. There are some differences there. Cancer-related fatigue is typically more long-lasting than just general fatigue. And cancer-related fatigue doesn't necessarily get better with rest, whereas general fatigue can tend to, get better with rest. And with cancer-related fatigue, the cause may be unknown, and again, has all those different factors that, can cause and contribute to fatigue. And then with general fatigue, it can be easier to link the cause. So those are just some differences there. And then when thinking about the causes of cancer-related fatigue, all different types of cancer and cancer treatment can cause fatigue. Such as inflammation can cause swelling in certain areas of the body. If you're having a lower number of red blood cells, that can affect the fatigue. Changes in hormone levels, different treatments can produce different effects. And just having a lack of appetite from treatment can also cause just inadequate nutrition with it, which then can contribute to fatigue. And additionally, so a combination of different types of treatments like chemo and radiation can cause fatigue, and it can cause it if the treatments are at the same time, or if they're kind of back to back, not necessarily at the same time, it can all kind of contribute to fatigue. So there's no exact known reason for the cause of cancer-related fatigue. It can just be a lot of different factors that contribute. Okay, so going off of that, the contributing factors for cancer-related fatigue: anemia, if you're having a low amount of red blood cells in the blood, that can contribute to fatigue. Decreased nutrition, like I mentioned, from side effects, such as if you're experiencing mouth sores, nausea, things like that, that can contribute to decreased nutrition, can also contribute to the fatigue. Dehydration, of course, medications that can treat other side effects like nausea or depression, those can also then contribute to fatigue depending on the side effects. Pain, sleep difficulty like insomnia, obviously, if you're not getting the adequate sleep, that can also contribute to fatigue. Infection, and then just lower activity level altogether can just contribute to the fatigue. Additionally, there are some emotional challenges that may cause fatigue and just contribute. Anxiety, depression, grief, stress, just stress managing all the different medical information and treatments within cancer, they can all kind of cause fatigue and contribute. Many emotional challenges such as depression can be difficult to determine, which occurred first, did the depression kind of cause and contribute to the fatigue, or did having the fatigue kind of contribute to the depression? Oftentimes these kind of occur together and it's not sure which caused which. But if you are experiencing some of these emotional challenges, it'd be important to just seek support through a licensed mental health professional at Gilda's Club or somewhere else if you believe that fatigue could be due to the emotional challenges. Okay, so here's a little kind of graphic to organize all the different contributing factors to fatigue. So as you can see, there's so many different aspects to think about that can contribute to fatigue, and it's important to really think about for you what falls in all these different areas in order to get the best grasp on your fatigue. So other health conditions can cause fatigue, while fatigue can also make other health conditions worse. And there are also medications to treat the underlying cause of fatigue. So again, it's important to talk with your doctor. Comorbid conditions are noted there. So where some conditions can be present at the same time as fatigue, and those can be dysfunction with cardiac system, endocrine, renal, pulmonary, anemia, which I mentioned, arthritis, neuropathy. A lot of different things can kind of occur together at the same time with fatigue. And it's just important to address all different medical and comorbid conditions and just any of these contributing factors if you can, in order to get the best grasp on fatigue. So for example, if you're experiencing pain, it likely is also taking some of your energy and contributing to fatigue that you may have. So if you can also get a grasp on that pain, then you can better address the fatigue as well. So outlook here. So for most individuals, fatigue can disappear after treatment stops, but there are some, about 35%, that can experience fatigue even after finishing treatment and with no known cancer. So it could last for months or years after treatment. But for others, after completed treatment, you might experience no side effects of fatigue, and then later on it might come back. For chemotherapy, it's noted that fatigue can last a few days after having that, or it could persist after completion. But with radiation, it's more of a cumulative fatigue that occurs, lasting 3 to 4 weeks after the treatment, but it could persist 2 to 3 months. So a little bit on prevalence. Fatigue's the most common side effect of cancer and cancer treatment, which is why I thought it would just be really important to discuss through this presentation. And 80 to 90% of individuals with cancer have reported fatigue. So what does fatigue affect? It can make it difficult to concentrate and have some difficulties with memory, having problems with your thought processes and just making decisions. You may feel out of breath after a light activity that you feel maybe you hadn't in the past. You may feel dizzy or have lightheadedness, changes in mood and emotions, and it could make just your arms and legs feel heavy. Impact on your life. Chronic fatigue can be a barrier to just day-to-day function and doing those simple everyday tasks that you are wanting and needing to do. You may feel that it's taking a longer amount of time to do things that used to not take as long. It could negatively affect your the tasks that you're doing at work, could reduce quality of life. It could cause sleep problems, and as I mentioned, sleep problems can make fatigue worse, can contribute to loss of interest in sexual activity, and may make you not want to do certain things or feeling irritable. And it was noted that 91% of adults with cancer-related fatigue indicate that it's prevented them from leading a normal life. And the cancer support screen found that 56 of individuals felt that fatigue was somewhat to very disruptive to their daily life. So there's, obviously a need for some strategies and support managing this fatigue. So hopefully through the strategies that we'll talk about later, you all can maybe take something to use in your day-to-day life. So first, we'll go over safety considerations. Poor posture can contribute to fatigue and also cause pain at the same time. So just important to be mindful of the position that you have in all the activities and tasks you do in your daily life. We'll go over positioning in just a little bit as well. It's important to learn how to anticipate the fatigue and just know your tolerance with different activities and different positions that you may be in for those activities. So it's also important to take a short break before becoming overly fatigued and just anticipating the warning signs of impending fatigue, which could be whole body tiredness, difficulty concentrating, lack of motivation, impatience. And also with just kind of like heavy work and heavy objects, potentially asking for help or using a different strategy for that, which we'll go over, could be beneficial just because if you're exerting, too much effort, if you kind of overexert yourself, it can then like last for a longer amount of time and impact like more of your day. So energy conservation strategies. So these strategies that I'll mention may seem relatively straightforward, but they may require you to change your current habits and routines, which can actually, is difficult to really implement. So we'll go over strategies and then we'll also talk about how to actually implement it into your day-to-day life. So general strategies, these are kind of like the 5 P's to remember. And we'll go over them more in depth, but the 5 P's are plan, prioritize, pacing, positioning, and pursed lip breathing. So just remembering to breathe. But yeah, with planning, so it's important to just prioritize what you need to do each day. Scheduling important and highly demanding tasks when you know that you have the most energy, but then also not doing them all on one day. So being able to balance them throughout the week, because you wouldn't want to overexert yourself on one day and then not be able to do as much the rest of the week. So just prioritizing and balancing throughout the week what you need to do. alternating between heavy and light tasks, and also balancing work and like doing something with rest. Even if you plan to do something on a certain day, it's important to just remember to be flexible and listen to the warning signs that that you're feeling fatigued and not feeling obligated to finish something. You obviously don't want to push past any limits that you have. So even if you plan to do something on a certain day, just keeping in mind how you're feeling and not pushing past that, because again, you wouldn't want to overexert yourself and then not have the energy to do things in the following few days. It's also really important to plan time for leisure activities. So it could, if you're trying to do things that you need to do and planning things that only you need to do, you might miss out on the things that are really enjoyable to you. So it's important to also prioritize those things that you really enjoy within your life, and then also use efficient methods, which we'll go into. The second P is prioritize. So modify and reduce task demands. You can do this by using different electrical appliances or adaptive equipment that kind of reduce the demands for you. Eliminate unnecessary tasks. If there's anything that you can kind of think of that you don't need to do necessarily that one day, then just eliminating that to, conserve the energy that you have for other things. Delegate tasks to others if you can, things that maybe aren't as important to you but would be easier for someone else to help with. And then also combining tasks if it's not too fatiguing. So if you were to combine two tasks, like for example, like taking out the garbage as you're like on the way to the car, something like that, if it's not too fatiguing, that can, minimize the amount of trips that you have to do, things like that. But yeah, just keeping that in mind. Okay, let's move. There's my mouse. Move to the next P. So pace yourself. Take your time when you're doing something. Don't rush through an activity. It's important to remember to just take a break. Like, don't try to rush to finish something, because you want to make sure to rest before fatiguing. And then balance rest and work, as well as the light and heavier demanding tasks, just to be able to pace the energy that you have. And pacing helps prevent exhaustion and deconditioning that may follow with long periods of sedentary activities. So it's more productive to complete tasks at a reasonable speed rather than going too fast and tiring yourself out, because again, you might become overly exhausted and not be able to do things in the future. So shorter, more frequent rest breaks are actually more beneficial than taking longer, less frequent ones. And yeah, so that's for pacing. So positioning, like I mentioned, poor posture consumes more energy. So it's important to just be mindful of the positioning you have when doing different things. So if you can, sitting during an activity or task would help with conserving energy. Specifically, if you were to sit on a higher chair, they're easier to then stand up from. But you also want to be mindful of not, like if you are on a higher chair, you don't really want to have a position of like stooping and leaning over for a long period of time. So the balance of that. You want to avoid prolonged stooping over, standing, and squatting. And you can use equipment to help maintain good body mechanics if you do have to stoop over. So I'll show a picture of it a little bit later, but like using something like a long handled reacher in order to grab something that's high up or low below, so that you don't have to, stoop over as often, and refrain from holding one posture throughout an entire activity. So it's important to just keep moving and change positions regularly, even if you don't think you're in like a stressful position. Just continuing to move is important. And also using gravity to assist you, not resist you. So this basically means, like, for example, if you, instead of like picking an item up to move it, if instead you can kind of push it, that would be kind of working like with gravity instead of like working against it, which would require more energy. And then when doing something seated, try to support your elbows and your forearms on the table or on armrest, just to give yourself more support. And it would just require less, energy to support yourself up. continuing with that and body mechanics. So when carrying objects, try to just keep it close to your body and distribute your weight between both of your arms, and obviously bend at at your knees and your hips and not your back as much, and try to not twist if you're like carrying something. Avoid any position that impairs your breathing, such as bending over or reaching up high. You want to make sure that you're always breathing and breathing through movement. And like I mentioned, kind of push before pulling and pull before lifting. And if you're cleaning or doing other housework, try to position your body just close to what you're doing. And just remember to keep your back straight and lose your arms and leg muscles and body weight to help you when you can. So the 5th P here for the general strategies is the pursed lip breathing. So that basically means just inhaling through your nose 1 to 2 seconds, and then exhaling through pursed lips like you're whistling for 3 to 4 seconds. So this breathing technique just allows for more emptying through your lungs and then more oxygen getting into the blood, which can be relaxing. And this is just something that you can think about doing during rest breaks and also during an activity that makes you short of breath. It's always important to, remember to breathe when you're doing something to conserve your energy. And when you're doing a movement, such as like climbing stairs, just do the movement when exhaling, if you can think about it. So like if you're climbing a few steps, do that when you're exhaling and then stop to take an inhale. That's just one kind of method to use this. So a few general adapted methods. So some equipment, I mentioned that long-handed reacher. So that can just be used to grab things that are high up or not high down, but below, so that you don't have to, get into any positions that can cause more strain on your body. Another piece of equipment is a rolling storage cart. So this can be useful for really anywhere in the house. I think of it a lot of times like in the kitchen, but just to be able to have items that you use often close by and not having to, bend down and reach up to get a lot of things, like just having it nearby if you need certain things. And then other long-handled equipment could be beneficial, like a hairbrush. That's a long equipment so that you don't have to, raise your arms as much to brush hair. Even with cleaning tools, there are like handled dusters, so you don't have to bend and stoop as much. And also just like dustpans, things like that. They make a lot of equipment with longer handles, which will help conserve energy. General strategies around the home. It can be useful to just put items by the staircase that you need to bring up and down so that you don't have to make a lot of unnecessary trips, and you can remember, to do this so that, you just don't have to make a lot of unnecessary trips. And putting everything you need for an activity or task together before starting, so that you don't have to keep running back and getting more things. And then plan what you'll need for these different activities and tasks that you will be doing throughout the day, so that you know that you have everything you need. If you need to, buy something or just get something together, that's just kind of like the planning aspect. And then another strategy could be to keep extra sets of items at various places around the home. So like if you notice that you're needing like pens or scissors or something like that in different parts of the home, if you can just keep those at different, areas where you think you might need certain things, then you don't have to run around as much. So we'll move into the kitchen. So strategies in the kitchen: plan ahead. So creating a meal plan at the beginning of the week before grocery shopping can be helpful, so you don't have to take multiple trips. And also just gathering all the ingredients that you need, and cooking utensils before starting to cook would also be beneficial. And learning when, like what time of the day you have the most energy can be helpful for knowing when to schedule grocery shopping and cooking, so that you can do it at those times where you do have the most energy. And then trying to just balance energy demanding tasks. So cooking can take up a lot of energy. So trying to cook a large meal on one day so that you just have to heat it up on other days, or allowing others to help you with the cooking can be helpful. Other strategies to maybe modify the demands or the expectations with cooking. You can utilize frozen meals or already prepared ingredients like pre-cut vegetables and fruits, so that it just kind of reduces the steps, needed within cooking. Also allow more time to cook. So you don't want to rush through what you're doing. And even taking 5 to 10 minute rest breaks would be beneficial than trying to just rush through and finish it all. And if needed, you could even break cooking into smaller components. So, preparing some types of foods one day and then the next day kind of putting it all together to make whatever it is, something like that, to just kind of break it up into smaller components. And also using the microwave instead of the stove or oven could be helpful. Some adaptive methods with cooking, utilizing grocery pickup or delivery could be helpful. It's important to store commonly used items in places that are easy for you to reach. So like between shoulder and waist height, so that you don't have to do that bending and reaching like we mentioned, or using that reacher if you can't kind of reorganize the items. Use a chair to sit while cooking. Adjust work height so you aren't leaning over. And then some equipment that you could find helpful would be like a non-skid cooking mat, so you don't have to use both your arms to keep things in place. Anytime you can use like an electric chopper, things like that, so you don't have to chop it up all yourself, or electric can opener, jar opener. And also just lightweight tools would require less kind of strength and force needed to operate them. So anytime it can be more lightweight, that would be beneficial. So specific to the bathroom, sitting in a chair when putting on makeup, styling hair, shaving, just anything that you can would be beneficial. If you just can like keep a chair like in the bathroom, if it could fit there, that would be helpful if you're feeling fatigued and just to conserve your energy. It's also important to consider the time of day when you are taking a shower or bathing. So when you're bathing in hot water, after you get out, you can have a drop in your body temperature, which can cause you to be more tired. So you can consider turning down the water temperature before getting out, or just figuring out the best time to shower for you, whether it's like whenever you have the most energy in the day or before bed, since it can cause you to be more tired. But it's important to figure out when that is best for you, because there are, some safety considerations to keep in mind with that. You wouldn't want to shower at a time that's so fatiguing that, it could be a harm to your safety in the shower. So just keeping that in mind. And if you are too fatigued, just using wipes or kind of like just other ways to freshen up for that time, and just like holding off until you feel that you have enough energy to do that. And then using dry shampoo can help prolong the need to wash your hair. So some different pieces of equipment that could be helpful in the shower to just conserve energy would be handheld shower head and using a shower chair to sit down so that you don't have to stay standing the whole time. And then the handheld shower head can be useful if you're seated, just to be able to, move the water where you need it to go. Grab bars in the shower are just really necessary to keep you safe and have a way for you to hold on and have more control in the shower. A long-handled sponge can be beneficial. Just again, anything like long-handled can help with, reducing the different positions that you have to put your arms in, and just being able to reach every area that you're trying to, reach. And also just electric toothbrush, anything kind of electric with any of these kind of methods would be beneficial, just so you don't have to, manually do things as much. So specifically for dressing, again, sitting in a chair when dressing can help conserve your energy. When putting on shoes and socks, you can put your foot across the opposite knee so that you don't have to bend over as much. And setting out your clothes at times when you have the most energy would be beneficial, so that you are just prepared and don't have to do that when you are feeling more fatigued. And using loose fitted clothing or shirts that button down the front would require less energy. So that could be something to just keep in mind. Adapted methods here. These are two different forms of sock aids. So in addition to kind of putting your foot over on the other knee to put on like socks and shoes, these can be helpful for putting on socks, so you don't have to reach over as far, and conserve energy in that way. So that's one example. Also, on the left two pictures here, this is a dressing stick that can be helpful with different aspects of dressing, but as seen here, taking off socks, so you don't have to lean over as far. And then a long-handled shoe horn can be just really helpful for putting on shoes, so you don't have to reach over again. So within the community, sometimes when individuals are feeling more fatigued, they might, avoid going out and doing things outside of the home. And if you feel that that might be something that you do, you might consider getting a transport wheelchair just to use on those occasions to just conserve your energy and make sure that you're able to get out and do what you need to do. I'll show a picture of that on the next screen, but that's something that you don't have to use all the time. But if you're on like a long, trip outside the home, it could be helpful. And it's just important to, when you are going outside the house, just planning what you're doing. So like writing down where you need to go, what you need to buy, and combining tasks to minimize unnecessary trips. So like if you can, get your groceries and then also get, a birthday present for someone at the same store, stuff like that. If that isn't too fatiguing, combining those types of tasks can be really helpful. So you don't have to make unnecessary trips. And then when grocery shopping, you are able to utilize motorized carts in most grocery stores. Since there is a lot of walking and grocery shopping, you can also ask the cashier to bag items to be more light, so like more half-filled bags. That way it's easier for you to manage when going in and out of the from your car to bring all your groceries in. And you can also ask the cashier to bag refrigerated foods separately, so that you can take maybe those inside at one point and then rest, and then take the non-perishables in from your car at a later time when you have more energy. And then most stores can help transfer groceries into your car as well, so that's something to keep in mind. So on the left here, this is kind of what one option of a transport wheelchair would look like. Again, that can just be used when going outside of the home for like long periods of time if you think you might get fatigued, having that on hand. This is a grocery cart in the second picture there. That could be useful to just have, keep it in your garage or keep it in your car every time like you're getting groceries to transport them that way. And then these are two different kind of grocery bag holders that I found that could be useful. One's like a bag carrier there, and then one you kind of can put it either on your wrist or over your shoulder. So there's just different ways to do that. So these are some of the strategies that I'm included in here, but it's not an exhaustive list. So if you want strategies for a specific activity or task, definitely give me an email. I would love to help find specific suggestions that would work for you. So please let me know. So now we'll move into sleep hygiene. So it's important to maintain a regular circadian rhythm. So trying to only sleep at night and go to sleep and wake up at the same times each day. Since sleep and fatigue can be so interrelated, with one causing the other and one, contributing to the other, it's important to, keep in mind the sleep hygiene and ways that you can, help your sleep. So even though you may be feeling fatigued throughout the day, it's important to avoid sleeping in the daytime. And if you need to nap, taking a really short nap, just 15 to 20 minutes, and only really in the late morning or early afternoon would be best. And it's also noted that if you exercise after waking up for a nap, that could be beneficial. But really just trying to avoid sleeping in the daytime so that you can keep that regular circadian rhythm. And it's also important to just only use your bedroom for sleep or sexual activity, not try to do like a lot of different things in your bedroom during the day. Analyze and manage secondary factors that contribute to poor sleep. So just like with fatigue, it's multifactorial. There's different things that can contribute to having poor sleep. So if you are experiencing pain or depression, anxiety, just trying to manage those as well can in turn benefit your sleep. So a sleep routine, try to develop a regular routine to stick to. Try to go to sleep and wake up at the same time, like I mentioned. It's important to try to avoid caffeine, alcohol, or tobacco products at least 4 hours before bedtime, and turn off the TV and smartphone at least an hour before bedtime to just get that light away from you. Avoid any emotional, important, or stimulating activities before bed. Things like paying bills or responding to emails, things like that. Those can be those important, stimulating, emotional activities that you want to try to avoid. And if you can't fall asleep after 15 minutes, just try leaving the room and avoiding any like mental stimulation, and then just like returning after that. Sleep environment. So it's really important to keep in mind the environment that you're sleeping in, because that can really have an effect on the sleep that you're getting. So it obviously you want it to be a comfortable environment. Put everything you might need during the night at your bedside, like a glass of water, things like that, just so you don't have to like get up in the middle of the night. The best positions for sleeping, if you're sleeping on your side, if you put a pillow under your head and then between the bent knees, or if you're sleeping on your back, a pillow under your head and then one under your knees, those can be the best positions. You want to keep it a cool temperature around 68 degrees. That can be better for sleep. Additionally, having a clean environment can actually really help with your sleep. So just trying to reduce the clutter in your room. Obviously dark. And then if you're a person that, needs white noise, like it's just important to remember the noise that you need. So if you need it to be quiet or if you need white noise, just knowing what you think is best for your sleep. So now we'll move into stress management and relaxation. So reducing stress can also help to reduce fatigue. So one way is through mindfulness-based stress reduction. So it's been shown to help individuals post-treatment for cancer improve their sleep quality and quantity, and reduce distress and improve psychological well-being. And another study found that in outpatient cancer patients, mindfulness-based stress reduction was shown to reduce total mood disturbance, depression, anxiety, emotional irritability, stress, cognitive issues, and cardiopulmonary and GI symptoms. So there are some research to back up the use of mindfulness, and there are actually ongoing mindfulness meditation classes offered at Turning Point. And also, if you haven't heard of the Calm app, they do have meditations and kind of relaxation, stress reduction options through that app. So then relaxation has also been found to be beneficial in reducing fatigue during treatment, but it was actually less effective after treatment, but still beneficial. Relaxation can also improve pain, which, as we discussed, can be a contributor to fatigue. So activities that are relaxing to you, it's important to just try to plan those throughout your day to contribute to just being relaxed. So if for you reading a book or going outside to get fresh air, listening to music, if those are things that are relaxing to you, just making time for that. Other relaxation techniques are breathing exercises, guided imagery and visualization, rhythmic exercises, so like walking, things like that, progressive muscle relaxation. Those are just a few. And I also wanted to note that we do have guided relaxation classes offered at Gilda's Club. And I did just want to note quickly that there has been some research on massage and how that's been beneficial in reducing fatigue for those currently going through cancer treatment. So now to touch on exercise, this is just a little graphic here to show just the cycle that is easy to fall into when experiencing fatigue. So you might have inactivity that can cause you to be weak and stiff, and then that can result in feeling fatigued and just not having not engaging in as much physical activity as you may once have. And then due to not engaging in physical activity, you could have weakness or difficulty doing, activities within your day-to-day life, which then can make you then avoid physical activity. So just something to keep in mind, how it can kind of be this cycle that can be, difficult to disrupt, but important. Regular exercise has been proven effective at managing fatigue. It's important to start slow, though, and have gradual progression, because with fatigue, like I've mentioned, you wouldn't want to overexert yourself doing too much at the beginning and then becoming too fatigued and not being able to do the things you want to need to do in the following days. So just starting slow with exercise is important, or keeping the current level of activity that you had. That can really help you to continue just that routine and to continue to be active. So if you're experiencing fatigue, sometimes people may feel like they don't have enough energy to exercise. So it's just can be helpful to find ways to conserve energy throughout the day so that you have enough energy to exercise, and just planning that into times when you do have energy. Moderate intensity exercise like brisk walking, cycling, swimming has been shown to be safe. But it's also important to talk to your doctor before exercising, just to make sure that it is safe for you and that you can figure out the best exercise plan. Aerobic and resistance training has been found beneficial in reducing fatigue when used together or separately before and after treatment. And also another study found that aerobic exercise has been found to significantly reduce fatigue in adults with cancer before and after, or during and after treatment. And most studies include walking and stationary cycling. So yoga has been beneficial in reducing fatigue during and after treatment. And yoga also has benefits for other cancer-related side effects that, again, might contribute to fatigue. So like decreasing pain, reducing anxiety. It can improve functional outcomes and also improve sleep. So all in all, those can also contribute to fatigue. And we do have virtual gentle yoga offered at Gilda's Club, March 10th and April 14th. Tai Chi has also been shown to be beneficial in reducing fatigue after treatment. And in a study on individuals with lung cancer going through chemo, Tai Chi was found to be effective in managing the fatigue symptoms, shown to decrease general fatigue and physical fatigue while increasing vigor. So now we'll just touch on nutrition. So cancer and cancer treatment can cause nutritional changes that can also contribute to fatigue and make fatigue, greater. So these can be like weight gain or weight loss, anemia, nutritional deficiencies. Those can all impact your fatigue. Dietary intake before, during, and after treatment also affects fatigue. It's important to just remember that hydration is so important, and to just drink 8 to 10 8-ounce glasses of liquids a day. Also, sometimes people may have cancer-related side effects like mouth sores, nausea, diarrhea, that impact their nutritional intake. So trying to find foods that don't aggravate those side effects so that you can continue to get the nutrition you need will also in turn affect fatigue. You may want to seek out a registered dietitian to help just recommend the specific dietary changes that you could make. And I included the contact info for the University of Kansas Cancer Center. Whoops, let me go back. Dietitians. So that is the number there if you are interested in contacting them if you think that nutrition may be impacting your fatigue. Okay, so now the last part of this, I'll try to move through this so then we have some time for some questions at the end, but putting this management into action. So you can start with just setting your priorities. If you want to list the activities and tasks you want and need to do for a day or a week, and then rank them in order of their importance, this can just help you be able to plan and set your priorities for what you need and want to do on certain days. So When you have that list, you can ask yourself, what do you enjoy most? What is most important to you? What absolutely needs to be done? When does it need to be done? How often? Is this an ongoing thing? Is there anyone that can help you with that? What could someone help with so that you have more energy to do the things that you might care more about doing? What do others expect you to be doing? And then what expectations do you have for yourself, and are they the same? And then choose activities you like to do yourself. And from those activities, are there any adapted methods or strategies mentioned that could make it easier? Are there any, questions you have that you might be able to talk through with me for seeing if there might be any adaptive methods or strategies to help do those? What time of day would you do those? These are just all questions to think about. And you want to think about simplify and eliminate. So certain things like utilizing services that offer easier methods like grocery delivery, that's one way to simplify things. Another way, like simplifying tasks, like allowing dishes to drip dry instead of manually drying them, or eating a frozen meal, just trying to balance that and simplify things that you can simplify. With eliminating, think through what tasks could you eliminate altogether, and then delegating some to others or choosing tasks that you ranked maybe lower importance, that if someone else did them, no one would be worse off. And then trying to reduce the frequency. So as I mentioned, a lot of these strategies could seem simple, but it involves changing habits and routines, which can be difficult. So to start with that, you can start with just setting goals and developing like problem-solving strategies to meet the goals and monitoring progress. As I mentioned, I can help with goal attainment. So if you'd like to email me, if there's something that you think you like to implement in your day-to-day life, you can email me and we can work on goal setting together. There's also apps that can help track habits that could be helpful. There's an app called Streaks or Productive Habit Tracker that I found that can be used for this purpose if you might want to use your phone to do that. And then also using a planner or an agenda to plan activities based on the fatigue patterns you have, that can be helpful. Warning signs of impending fatigue that you want to just be alert to, because again, resting before fatigue sets in can be really beneficial. So some signs are having tired eyes, tired legs, or just full body tiredness, stiff shoulders, difficulty concentrating, lack of motivation or boredom, impatience, increased irritability, lack of energy, increased nervousness or anxiety. So these are just some warning signs of fatigue. And you may have some that are really unique to you, and you may already realize the signs of fatigue that you have, but it's just important to kind of learn those, because some of these, early signs of fatigue, you wouldn't necessarily realize that could be fatigue because it doesn't seem as, physically a sign. It can be even more kind of with cognition. So just being aware of that. And then for ongoing self-monitoring, there's a thing called a fatigue diary, and I'll show an example on the next slide, but using a fatigue diary or journal can be just really helpful in order to find patterns in fatigue that you have, so that you can plan certain activities around fatigue levels when you have more energy for some things and when you can, plan to rest during certain times of the day. It can also help with finding things that might affect your fatigue, things that might improve it or worsen it. And then using this, you can also note any progress that you made in fatigue management. So I'll show you this example here. This is just one example. But so this is like for each day, you would note in the morning, afternoon, or evening, on a scale of 1 to 5, how you were feeling with fatigue, and then kind of talking about any notes that you have or what you're kind of doing during the day, and just noting any ways that fatigue could have contributed to, what you did throughout the day and things like that. Here's just another example where you can record your level of fatigue. You can either do like the 1 out of 5 or like a 1 out of 10 for different times during the day. And then again, it's just basically like making notes of what you did and comparing that fatigue level. These can also be helpful to kind of have an objective way to show your doctor or any other medical professional like the patterns of fatigue that you have, so that you're just better able to manage it. So here are the references that I had for my presentation. I'll go through them slowly here. And then the pictures that I utilized. And like Amy mentioned, she will be sending out a follow-up email for this program that will include a resource that has the general strategies and some links to fatigue diaries, just like that you can look at. And then also the link in the email to an anonymous just feedback, like fill in the blank box. And since I am a student, I would just love any feedback that you'll have, things that you liked from this presentation, things that you would have liked to see, continued needs that you think that you're having, just anything that you would like to provide for me so that I can best meet the needs of individuals at Gildas Club. Thank you all for attending this program. I'll stop sharing my screen. And if anyone has any questions,